We are in IFSO. For me, it's very important to talk with the president. He was just elected. So let me introduce you. He's Dr. Khaled Gawdat. Am I right?
Yep.
Yeah, President of IFSO. It's very nice to meet you.
Thank you. Nice meeting you.
Where are you from?
I'm from Egypt.
Yeah, do you live in El Cairo, no?
Yes, I live in Cairo.
How is the obesity nowadays in your country? It is a big problem?
It's a huge problem in my country and everywhere. It's some countries have more than 60% of the population is obese. So it's a huge problem, health problem, and it's worldwide.
And what is the situation and what are the treatment that you have in your country? Same that other places? Medication, drugs, and
yeah,
bariatric
we used to have
surgery?
medications, drugs, bariatric surgery. Now we have endoscopy, and we used to call these competing. So we think that surgery is better than medication is better than endoscopy, but now we think it's complementary.
It's complementary, it's not a competition.
We have to choose.
Who is the enemy? The enemy is the obesity.
Exactly, and we need to give our patients a cure from the diseases that the obesity has caused, not just to make them look nice. Of course, the byproduct is that they will be slim and look nice, but the more important thing is to fix the health issues.
Let's talk about IFSO.
Yes.
What is the importance of IFSO?
IFSO is the biggest organization for obesity treatment on the planet, because we used to be only inclusive for surgery, so it was the International Federation for the Surgery of Obesity. Now it's the International Federation for the Surgery and Other Treatments.
And other treatments.
Of obesity, so it's all inclusive. And we have 76 countries in this organization, more than 10,000 members. For obesity treatment and obesity surgery, this is the biggest organization.
How was the Congress in Chile?
Well, it was better than I expected.
Really?
Yeah,
that's good.
It was very well arranged, very well attended. We had huge people coming, a number of people coming, and the sessions were planned very well, and everything went very well.
How important is to share different point of view, different experience, different knowledge about obesity?
This is the education. So if I think, you know, they say when you talk, you only listen to what you know, but if you listen, you might learn something new.
Yeah.
So when we come to conferences and see one-on-one experiences from surgeons and side talks and studies and scientific numbers, and that is collectively a very good learning experience.
So now I'm going to learn from you.
Yeah.
We know that obesity is a chronic disease.
Yes.
It affects a lot of people nowadays.
Yes.
And we have different kind of treatment. One of them is the metabolic, the bariatric surgery.
Yes.
No? And I want to talk about that surgery.
Sure.
It is safe.
Over the years, it has become more and more safe. So now the safety of a bariatric operation, it's safer than having a gallbladder removed, which is like a simple, yeah. So because it needs a lot of experience and training, but after surgeons reach this experience and training, it's pretty safe.
It's pretty safe. But what do you think about the access to different
the access is limited for several reasons. One of them is the expensive. Patients don't have insurance, and the other thing is the patients are afraid of having to go through surgery just to lose weight. But for them, if they understand that this is disease curing and they will have much better health, much better way to live, that's a completely different thing. So we're trying to make campaigns to make people aware of the benefits and not to be afraid from surgery.
What are the benefits?
Oh, the benefits are clear. You lose all the weight and you get cured of any disease that is caused by obesity. So,
beyond the physical benefit, you have another kind of benefit, social benefit, psychological benefit.
Of course, that's
what do
when
you see in your
weight.
patients?
That's, you see, we are as scientists, we care very much about disease the cure. So patients will get rid of their hypertension, their diabetes, their joint problems. But the patients, actually, most of them just want to look better. So what about if you have a surgery or a treatment that would give you both?
Perfect.
So you look better, you have your life back on track, you have to have your social life completely, all the problems of being overweight are gone, and all the diseases are cured. So it's a win-win situation.
Yeah, that's good.
Yeah.
But we have to educate people, and we have to show them how many treatment for the obesity
Yes.
they can.
And my advice is that they should seek for the doctor's consultation earlier the better, because like when you have diabetes, if it's very long, it's been there for very long, the chances for us curing it is less than if you have like diabetes for 1 or 2 or 3 years. That would be a much higher cure rate.
What happens if you have the surgery but you don't change your lifestyle?
We used to blame the patients for this, but now we can help them, because first we have very powerful medications that we didn't see, they weren't there 5 years ago. So if I have a patient that like snacks all day and they don't want to change their lifestyle, I can help them and give them a little push with medications after surgery. So the combination will work. Of course, we would like them to change, and most of them, because of the positive changes they go through with their weight loss journey, in 6 months, they are normal weight people. So many of them would cherish this very much and wouldn't lose this for anything.
So, what is the future of metabolic bariatric surgery?
The future is bright, because unfortunately the problem is huge. So
It's growing.
we're currently treating only 1% of the patients that need surgery. So the future is there. And having more means and tools for treatment would help boost the practice, because if I have a patient that doesn't want to have the surgery, I can start with medications with him. He would lose some weight, and then if he stops medication or gains weight, I then can offer him an endoscopy or bariatric surgery, and then maybe if they don't change and they want some help, I give them again some medication. So it's now, we're not talking about one-step solution, we're talking about weight loss journey. So the journey, we will support our patients at any stage of their journey, and we can help them with so many tools we have nowadays.
I want to thank you for this conversation. It was very nice to meet you.
Thank you.
Good luck with IFSO and your president.
Oh, thank you very much. Thank you. Okay.
And thank you for being with us. See you in another conversation.